since you guys mentioned on Sunday you wanted some more strategies for corrective exercise, I figured I'd show you a really quick example of some things to be able to do based on the 4 components that Reed talked about. So the first one was restoring tissue quality. And you know how Natalie obviously mentioned being able to do some massage work. The power plate is a phenomenal tool to restore tissue quality. You can also incorporate the self-myofascial release. So let's say we're working on thoracic spine, some kyphosis of that, and maybe like forward shoulders, forward head positioning. To restore the tissue quality kind of the pecs, very specifically like pec minor and anterior delt as well, I would suggest putting the power plate on 30 hertz high for 30 seconds. Grab the little ball, and then you're going to have your client come down, shoulder on top of the power plate. And obviously you want to be cognizant of a person's anatomy when doing this, but very gently just start to do some tissue manipulation by putting a little bit of pressure and then also using the power plate, which should help restore the length-tension relationship of the tissue. So that would be for restoring tissue quality. The second thing that Reed mentioned was to also stretch and mobilize. And again, these are using the strategies that the American Council on Exercise puts in place. So again, great suggestions. Stretch and mobilize. Arm on the ball, and then just allow that ball to navigate forward and perhaps even out to the side. And then just come back. And most of you know how I feel about static stretching, so I would say go ahead and just keep the body moving and then just gently allow that shoulder to kind of come away from the spine. Kind of gets the scapula moving on the back side of things, and then gets that client in a prone but also stable position on the other side. Next, activation. One of the huge things to be able to do with the power plate is to activate tissues. The best way to do this is by getting as much tension in the tissues as possible, because then you're going to get more travel. So simple activation strategy, power plate, head back to a low setting here unless your client is really used to the plate. Go ahead and just have them come into a push-up position. I'm going to do it on the side just so that way you can see, and just get as much tension as you can in the body and have your clients hold that. Spread the fingers, get the hands nice and active, and get as much tension as you can across all of those anterior tissues. It's also obviously going to travel to the back. And then the last component was the program design. So more or less however you want to use your exercise expertise and acute variables to do the program design. I would probably take my client into the weight room, have them do some inverted rows, because that, guess what, retracts the cervical spine and head as well. Maybe some bent over row type positions. If they don't have a stable spine to begin with, definitely throw those bird dogs in before going to bigger movements with lots of load. So hope that helps, gives you a few ideas. Let me know your thoughts if you want more, or whether you use this or not and if it worked. Thanks guys.